We need to bring Medicare into the 21st century to expand its coverage, improve its services, strengthen its financing, and give seniors more control over the health care they receive. Medicare's most pressing challenge is the lack of coverage for prescription drugs. Several people here with us this morning know from personal experience what that means. Frank van der Liden was a newspaper reporter, and a good one. Now he's being squeezed by high Medicare premiums and drug costs. Or Bobby Cherry, he's a senior coordinator at the Florida Avenue Baptist Church, right here in Washington. He pays close to 40% of his income for prescription drugs and Medicare copayments. Or Gwendolyn Black, who spends $2,400 a year to put 4 healing drops a day into each of her eyes. Today I announced the first step toward helping American seniors get the prescription drugs they need and deserve. A new national drug discount program for seniors that will begin early next year. Every senior on Medicare can receive a new drug discount card. It won't cost much, at most $1 or $2 a month, and will work like the cards you already have for, say, your groceries. Present the card at a participating pharmacy, and you receive a substantial discount. It's as simple as that, and it's convenient. The new drug discount plan combines the purchasing clout of millions of seniors to negotiate lower prices than under the current system. And under my plan, participating pharmacies will get new customers, and seniors will get high-quality drugs at a lower price. It's a plan similar to the plan that brings discounts to many Americans who have private insurance. And the leaders of the companies that have been so successful in providing drug discounts and private plans are here with us today and will brief the press on the savings about our strategy. The drug discount plan is the first necessary step to provide immediate help to seniors without destabilizing Medicare's finances. It is the first step, but it is not a substitute for a drug benefit and for strengthening Medicare. And that's why my administration has developed, with a bipartisan group of legislators, a framework for strengthening and expanding Medicare for the long term. This framework will guide us as Congress takes up Medicare in the coming months. And here are its main elements. First, seniors already enrolled in Medicare and those near retirement must have the option of keeping their Medicare exactly the way it is today. No senior will see any changes that he or she does not want or does not seek. If you like things the way they are, that's just the way they'll stay. Second, all seniors today and tomorrow will be offered a range of new Medicare plans, including an improved and updated government plan, as well as others offered by non-government insurance plans. All the Medicare plans must offer benefits at least as comprehensive as the government plan. All will be regulated by the federal government, and all of them must offer prescription drug coverage. Third, everyone enrolled in Medicare will have the power to choose which plan works best for him or her. The plans will compete with each other, forcing to offer better service, extra benefits, and lower premiums. All seniors in America should enjoy the same freedoms that federal employees have today when it comes to choosing their health care plans. We must trust seniors to make the right decisions for themselves. Fourth, Medicare must become more responsive to seniors, especially to seniors on low incomes and with unusually high medical costs. Sometimes people discover Medicare's gaps when they need Medicare most. Under the current system, the sickest Americans pay a higher percentage of their bill than others do. And that's not right. And under our approach, that will stop. We'll put a stop-loss limit on the amount any senior can be asked to pay in any year. Too many seniors feel compelled to purchase costly Medigap policies to cover what Medicare does not. Take, for example, Mr. Kyler Taylor, who's with us today. The Taylors spend more than $10,000 a year on drugs and Medigap insurance. Our framework will not only cover drugs, but it will reduce the need for costly extra insurance. The gaps in Medicare bear especially hard on low-income people, and extra help will be available to them as well. And finally, we must put Medicare on a sustainable financial footing for future generations. The two parts of Medicare must be combined into one. When popular alternative plans are established, the government's contribution to any one Medicare plan should eventually be tied to the average cost of all Medicare plans, preventing any one plan from driving up the cost that all Americans must pay. So these are the main principles for strengthening and improving Medicare. Nobody on Medicare will see any change in Medicare unless he or she wants it. There will be new Medicare choices, and all of these new choices will offer prescription drugs. Medicare plans will compete by offering better service and lower premiums. Medicare will respond better to the needs of seniors, and especially low-income seniors and seniors with high medical bills. And Medicare will be put on sound financial footing. These are principles which will strengthen one of our nation's most sacred obligations, the health of our senior citizens. We'll protect seniors now, offering exciting new services and more choices to seniors in the future, and guarantee prescription drug coverage. And we will do it without overtaxing our children and our grandchildren. Medicine is constantly improving. Medicare must keep pace. That's my administration's commitment today, and its exciting new vision for health care in America. Thank you all for coming.